Medication absorption is the movement of a drug from its site of administration into the blood. Oral drugs enters the stomach, sometimes it dissolves and passes through the cell membrane of the epithelial cells lining the stomach or travel from the stomach to the small intestine. The small intestine, which is the most common site of absorption. Here drugs dissolves and passes through the intestinal wall. Oral drugs then travel through the portal venous system to the liver with the end up of the first passive act. During this process, the liver metabolizes some of the drugs, either inactivating it or excreting into the bile for elimination from the body. The remaining amount of active drugs leaves the liver and reaches the general circulation and the target organs. If a drug is administered through an intravenous injection, it passes directly into the bloodstream, thus bypassing absorption in the GI tract. If administered through intramuscular or subcutaneous injection, the drug enters the muscles or subcutaneous tissue while passes through gaps into capillary walls, and from there it passes directly into the general circulation, and from there it reaches to the target organs, also by passive absorption in the GI tract. Bioavailability is the net amount of a dose of a drug that is actually absorbed into the bloodstream. The bioavailability of oral drugs is less than 100% because of the first passive act of the liver. In contrast, the bioavailability of IV drugs is 100% because they are not exposed to the first passive act of the liver. Different drug formulations alter bioavailability because they are not absorbed at the same rate or to the same extent. For example, tablets dissolved in varying rates. The entry-coated drugs dissolved in small intestine and not in the stomach because gastric emptying time differs between individuals and the absorption time may also vary. Cysteine released formula contains tiny spheres that dissolves in different rates, resulting in a steady drug release throughout the day, but also result in variable absorption. Some factors affecting the drug absorption are the rate of dissolution. The drugs that dissolve faster are absorbed faster. Next is the surface area. The lining of the small intestine is having more surface area than the lining of the stomach. So more absorption takes place in the small intestine and most of the drugs absorbs faster in the small intestine compared to the stomach. Next is the blood flow. The greater the concentration gradient between the drug filled in stomach and the rapidly flowing drug-free blood, the faster the absorption. Next is the lipid solubility. Highly lipid-soluble drugs passes through the phospholipid in the cell membrane more easily than drugs of lower lipid solubility. Next is the pH partitioning. Absorption is faster when the difference between the pH of the site of administration and the pH of the plasma attracts more drug molecules to ionize in the plasma. That is why we used to tell that all emergency drugs to be given by an intravenous route in order to get a faster action. And compared to all other routes, this intravenous administration gives a faster action in our human body.